Hello everyone, I'm Wendell Jones and welcome to this edition of the program Jones and Company. On this program we examine the national issues of the Bahamas. This past week the Ministry of Health advised the public that Zika virus is now circulating the region of the Americas and the Caribbean. Brazil remains the only country with potential deaths related to Zika virus, and to date there have been no confirmed Zika virus cases in the Bahamas. But we thought on this program we should speak with health professionals in our country so that the public would be aware of what is the virus and the various protocols that are in place. Our guest on the program today is Dr. Glen, Beneby, the Chief Medical Officer of the Bahamas, and later we are going to hear from another professional in his ministry. But for starters, we want to welcome to our program again Dr. Glen Beneby. Welcome, sir.
Thank you, Mr. Jones, for having me.
Godfrey, Eneas, it's nice to see you again.
You know, Dr. Beneby has become the face of universal health insurance.
Oh, yes.
Well, I'm a member of the team, but I think we have a strong team.
You have a very strong team. Now, you've been getting your message out, and I think you've been doing a very good job, Dr. Beneby.
Well, hearing that from you, Mr. Jones, is always encouraging.
Yes. Dr. Beneby, tell us about the Zika virus, and what is it really?
Well, the Zika virus is new to us here in the Western Hemisphere, but it really was first recognized in Africa and Asia, indeed in Uganda, in February this year. For the first time we saw it on this side of the Atlantic. But as early as 1947, in Uganda they recognized the Zika virus in animals, and then during the 1950s in the human beings in Uganda and Nigeria, and later in Polynesia, the French Polynesian area. So until February 2014, the virus really was in the population in Africa and Asia. But for some reason, it appeared here in the Americas and in the Caribbean region in February 2014. And since that time, we have been seeing increasing cases on this side of the Atlantic. What concerns us is the increase in cases, and perhaps more importantly, the fact that the virus is now associated with abnormalities in newborns. Newborns, particularly in Brazil, where the largest number of reported cases on this side of the Atlantic is now at the moment, born with small heads, which we call microcephaly. And the small heads are directly associated with, but not proven to be, a direct result of, and that's important to make that point. And so, as you note, the new cases have occurred in Haiti, which is close to us. Only today I'm informed that in Guadeloupe there's recognition of a new case, and in North America, as close as Florida, there's a case, and a number of cases on the East Coast. The Bahamas being what the Bahamas is, a global center in terms of tourism, in terms of people moving around the world. We know how important it is to us. We had the experience with global travel and disease with the Ebola virus, and we were very thankful that we were able to respond to that positively. We have upped our alert in our response to the Zika virus. I want to stress at this point that the opportunity we want to grasp is the opportunity that the community become involved early, so prevention is the key here. Prevention, prevention, prevention. Notwithstanding the fact that we will have in place measures to symptomatically entreat, because there's no cure for the treatment of the Zika virus, there's no vaccine for it. The President of the United States has called for those in NIH, the National Institute, to increase their effort to seek to find a solution. But at the moment, there's none other than for us to treat it in a symptomatic way. So the word we want out to the Bahamian people, let us be proactive. Let us be preventative. Let us do all in our power to stop the spread of this virus, and we do that at this time by addressing the vector. The virus is transmitted via the Aedes aegypti mosquito, and this mosquito also carries other viruses as well, dengue and chikungunya and yellow fever. But what we want to stress is let us be proactive. Let us get the public involved. Let us get the community involved. And any place in our environment where the vector may breed the mosquito or allow the mosquito to breed ought to be addressed.
Dr. Beneby, the Aedes aegypti mosquito was also responsible for the transmission, as you said, of dengue. We had in the last, well, some years ago, a large number of Bahamians who were sick with dengue fever.
There's no question that we had at that time what we consider an epidemic,
Yes.
dengue, because of the increase in the number of cases. And in those cases, the symptoms associated with dengue are more profound than those associated with the Zika virus. The Zika virus tends to have more subtle symptoms. You have the fever and the rash, and you don't have as high a fever and as profound demonstration of symptoms like you see with dengue. But what is an important point to mention here is that in these cases, there's always the tendency to recommend treatment with analgesics to break the fever and the pain, because you get muscle pain as well. But as we have stated, because of the similarity and the symptoms and the syndrome, we want to stay away from aspirin and all aspirin type drugs because it develops bleeding. It causes what they call Reye syndrome in these patients, especially children. And we have the problem of bleeding with dengue in particular. So the focus here is to give symptomatic treatment, but to stay away from aspirin and similar medications to aspirin in that family.
You spoke about the impact or how Zika affects babies or the unborn or newly born babies. But what about adults?
Well, the feature about this condition is that it affects primarily neurological pathways or the nerves, to put it simply. In the case of babies, you have the head being smaller, and as a result, the brain will be smaller because the head is smaller. In adults, to a less extent, there's been association with a condition they call Guillain-Barré syndrome, which is a demyelination of the nervous tissue. And as a result of that, the electrical impulses that are responsible for motor action are affected. And so there's progressive weakness in persons who are so affected. So it usually starts in the lower limbs and ascend, and it can go as high as the neck. And once it goes beyond the nerve supplies to the diaphragm, which is the cervical nerves, once it goes beyond that, then you have paralysis of your diaphragm and nervous system. And it affects your breathing. But fortunately, those cases are in the minority. But you can understand why adults ought to be very concerned, and we ought to come together. The community ought to come together to do all in our power to keep the environment clean, to dispose of containers where water can be collected, to not have vases that are filled with water and allow the larvae to multiply. And so we want to keep the numbers of the vector down. And if you can keep the numbers of the vector down, we will be moving in the right direction. Later in this program, just before I take a question from Mr. Eneas, you will have the privilege to speak directly with Dr. Greenslade, who is one of the, what I call on the front end of this, and she will be able to give you more details of what we're actually doing on the ground, along with the Ministry of Environment, to address this problem. And we're taking this very, very serious indeed to prevent any disease in our country as best as we can.
Mm-hmm. Well, since you mentioned about Dr. Greenslade, I'll hold my question, but the question now is, Dr. Beneby, we are a tourism country. We depend on visitors from all over the world to visit our country. What measures are being put in place to insulate us against the possible introduction of mosquito disease at these ports of entry?
Dr. Eneas, that's a very, very good question. And it gives us a moment to step back to what we had to do with Ebola, which was an even more serious condition in terms of the potential of the mortality that can result when you get the condition. But having said that, we have really done two things. And if you want to put them in two broad categories, there are certain things that we do in country, and there are certain things that we do outside of country. In country, we have improved and enhanced our surveillance at our borders. We have, as an archipelago, we have more than 50 sites, ports of entry, and people forget that, although maybe a much smaller number international ports of entry. And so what we are doing at the ports of entry is to alert all of our stakeholders, and stakeholders in this case are not just healthcare workers, but include immigration workers and anybody who will come into contact. What are the symptoms we're looking at? We obviously have a heightened alert when we deal with somebody who comes from an area where there's significant cases of Zika virus at the moment. And so we have a heightened alert. We hand out alert cards to people who come into the country and tell them to contact us if they have any of the symptoms. And so we try our best to give instructions when people are here as to what protective measures they can use in keeping with the Center for the Disease Control in the United States. We have specific repellent that you can spray, plus the clothing, long sleeves. In some cases, we can use the mosquito net, and we're suggesting that you use all the precautions. They also have some blankets that have been treated that we were pending to do some research on after Hurricane Joaquin. And now is a moment that we ought to use those blankets in areas where we have high rainfall and may not have the kind of response immediately to things we want to do. So we want our healthcare providers in those areas in particular, and persons in those areas, to have access to these special blankets that are treated. And claims have been made that by use of these blankets, you're able to keep mosquitoes from attacking. So we're using everything available to us and all of our resources.
Dr. Beneby.
I didn't mention what we're doing with the alert with countries abroad, because through the Ministry of Tourism, and I give the Ministry of Tourism kudos, they approach us well in advance, and we were able to work with them to get the message out to their centers abroad.
Dr. Beneby, one of the most vulnerable parts of our country is the southeastern Bahamas.
Indeed, yes.
It's vulnerable to drug trafficking, illegal immigration, illegal guns, and invasive species and certain diseases, right? That's the most vulnerable part. And I believe that is the parts of our country with the least infrastructure to protect us from the possible invasion of this mosquito-borne disease. What is being done, for example, in the southeastern Bahamas to improve the resources at these ports to protect us?
Well, like I said earlier, we are doing what we can do within our resources. We are educating. We are alerting the healthcare providers and the other stakeholders in those areas, which include immigration, police, and custom officers. The importance of proper dress when we have water, like after a rainy season or rainfall. But the point you made is well made. We are an archipelago. We extend more than 100,000 square miles, and it does present the challenge that we must, as healthcare providers and as community leaders, be that much more alert and depend on our community initiatives. And so we don't just expect healthcare providers to be looking at cleaning up the environment. We hope to get the community involved. And I stress this is about the third time I'm saying this, and it's so important in this case because these are things that the community can do. Get rid of the standing, stagnant water and all that sort of thing. I mean, as simple as a person coming along and turning a container over, that will stop us from having the potential of larvae in that particular setting. So we want our community, we're trying to, and I thank Mr. Jones and the other media who were helping us to get this message out. We were fortunate with Ebola, and we had many lessons learned from Ebola. We had people who came and we demonstrated the protective clothing in the cases of Ebola, and we are hoping in the very near future, over the next few days actually, to have demonstrable PR exercises that will show people. And we have the support of the Ministry of Environment with the director, Madam McKinsey, as well as the assistant director, Mr. Thompson. And we had a major press release with all of these key persons present. And of course, the minister, the Honorable Dr. Perry Gomez, made an official communication to the House of Assembly. And we're trying to use every possible measure to alert our population of the importance of prevention in trying to keep this virus out.
And while you are seeking to get the message out, and you are getting it out with respect to prevention, let's talk about the effects, or well, how pregnant women should guard themselves against the Zika virus, because I am given to understand that they are particularly vulnerable.
Well, the unborn child is. When women are pregnant in the first and second trimester, particularly the first trimester, you have the young-born fetus being more prone, because during that first trimester, you're actually, that's the first 12 weeks, you're actually creating or making or formulating, structuring the neurological system. And this virus is an RNA virus, and it affects the messaging of the formation of cells. And the neurological cells are more sensitive and more prone then to, if their message are affected, then you're likely to have malformations or congenital abnormalities. So what we say to our population, if you're pregnant and you know you're pregnant, if you're doubtful as to whether you're pregnant, then you should be tested to determine whether or not you're pregnant. We recommend to our people not to travel to areas where they know the Zika virus is now endemic and where they're seeing a number of cases. And if you happen to have the misfortune of going without knowledge, then you should be in close contact with the medical professional, obstetrician and gynecologist, who should monitor the baby in utero and determine whether or not the baby is developing normally. We, based on the World Health Organization recommendation, are not saying to women who wish to become pregnant not to become pregnant, because the linkage between the virus and the malformation is an association and not clear determination. But what we are saying to pregnant women or women of childbearing age, be more cautious, be sensitive, be careful, because what we have observed is the potential for babies being born with small heads or microcephaly.
Is there anything that they can do in terms of medication? There's no vaccine to guard against this, right?
No vaccine. And so in terms of medication, there's no direct medication you can use. Often in all of these cases, we say create the most favorable environment in which the unborn child can develop, such as making sure you take your folic acids and your vitamins and make sure you have a healthy diet as this process happens. But the most important thing, and it's interesting that you brought attention to it, because realizing the situation, we have formed a special team at the Ministry of Health, which is led by Dr. Percival McNeil, who's a well-known pediatrician, along with other pediatricians, and obstetrician and gynecologists in the hospital, to look at and to monitor the situation. Indeed, they had a special education seminar just a couple of days ago, where they had the interest so high that people were standing in the corridors.
Is that right?
That's correct. And so people are very concerned, and doctors and nurses, or who we say in the maternal child health, which involves pregnant women and children, unborn as well as early childhood, are very concerned and are paying a lot of attention, you know.
Good. So the Zika virus can impact pregnant women or the unborn child.
Yes.
If the mother is bitten by an Aedes aegypti mosquito, spreading the Zika virus. But there is a risk of adults as well who can develop the Guillain-Barré
Syndrome. Guillain-Barré syndrome.
Guillain-Barré syndrome. And that affects your breathing.
That affects your nerves.
Yes.
It usually starts at the lower end, so you come from your ankles up, and it can extend up to your neck. And if it extends up to your neck, it will, as it goes up, affect your respiration, and your respiration is necessary for life.
Okay. Let's take a break here. This is Jones and Company. Dr. Glen Beneby is here today, and later we are going to be joined by Dr. Felicia Greenslade, who is
from the Department of Surveillance, the Department of Public Health and Surveillance.
The Department of Surveillance.
Yes, within the Department of Public Health.
Okay, we take this break. We'll come right back.